Have you ever really thought about what happens to that little vial of blood you give at the doctor's office? Well, it goes on a pretty incredible journey. Today, we're going to pull back the curtain and step into the hidden world of the pathology lab. This is where scientists take tiny samples of blood and tissue and learn to read them like a story that can save a life. So let's see how they do it. Right, so you can think of every single sample that shows up in a lab as a book, one written in a language that most of us just can't read. The pathologist, they're the master translator. They're the ones who decode all those biological clues to reveal the story inside. And today, we're going to follow that story, chapter by chapter, and see how they uncover the secrets hidden deep inside our own biology. To make this all feel a bit more real, we're going to follow a patient. We'll call them Alex. Now, Alex has given two different samples. One is blood, and the other is a bit of tissue. Each one is about to go on a completely separate journey through the lab, and each one is going to reveal a different part of Alex's story. Okay, first up, let's follow Alex's blood sample. You can think of this as the opening chapter in their whole diagnostic story. It's the part that gives us that big picture overview of their health and, points us in the right direction. The story really kicks off with the collection itself. And trust me, it's way more than just a quick job with a needle. It's this super controlled, sterile process. From screening the donor to making sure those 450 milliliters of blood are mixed just right with an anticoagulant, every single step is designed to protect the quality and safety of this incredibly precious sample. After some analysis, the first major clue from Alex's blood pops up. It looks like they have anemia. So what does that actually mean? Well, it tells us there's a problem with the red blood cells, which are basically the body's oxygen delivery service. And this isn't just a piece of data. It's the first real plot twist in our story. It sets the stage for everything that's going to happen next. So, how do pathologists even start to figure this mystery out? They start by looking at something called the mean corpuscular volume, or MCV. Fancy name, but it's really just the average size of the red blood cells. Are they too small, what we call microcytic, which might suggest an iron deficiency? Or are they too big, macrocytic, pointing to something else, like a vitamin deficiency? This one measurement is like a compass. It points the whole investigation in the right direction. Now, let's say Alex needs a transfusion for their anemia. Here's a common misconception. They won't get whole blood. Instead, the lab gives them a very specific component. In this case, it would be packed red blood cells. This directly tackles the oxygen-carrying problem. And get this, it can be safely stored for over a month. But before a single drop of those red blood cells can be transfused, we get to what is, without a doubt, the most critical safety check in the entire blood bank. It's called the Crossmatch. This is the final, absolutely non-negotiable test to prevent what could be a fatal transfusion reaction. So how does this all-important test actually work? Well, the major Crossmatch is basically a trial run, but in a test tube. You mix a little bit of the donor's red blood cells with the patient's serum, you warm it up to body temperature, and then you add a special reagent. And the last step? You look for clumping, or what scientists call agglutination. If you see clumping, that's a no-go. No clumping means the blood is compatible. It's this careful, step-by-step process that guarantees the transfusion is going to help, not harm. The only reason we can even do these tests and store blood for transfusions is because of one crucial thing. We have to keep it liquid. How in the world can we store it for weeks? The secret is in the anticoagulants. For the storage bags, a substance like CPDA1 is used. It works by binding up calcium to stop clotting, and it can keep blood fresh for up to 35 days. That's a world away from something like heparin, which is really just for immediate tests because it doesn't preserve the cells for the long haul. Okay, let's switch gears. We're leaving the blood bank now, and we're going to follow Alex's second sample, that tissue biopsy, on its own unique journey. Now we're entering the world of histology, where the answers aren't in the blood, but in the very architecture of the body's cells. The absolute second a piece of tissue is removed from the body, a clock starts ticking. It immediately starts to decay. So the very first and most critical step is called fixation. You can think of it like hitting the pause button on every biological process. We use a chemical, usually something like 10% formalin, to preserve the tissue in a perfect snapshot of exactly how it was inside the body. This stops any changes that might try to hide the truth. After that fixation step, the tissue goes through this incredible transformation. Through a whole series of steps, dehydration, clearing, and infiltration, we slowly, carefully replace all the water in the tissue with paraffin wax. What you're left with is a solid block of wax with a tissue inside. And that is essential, because you just can't slice something soft and fragile with the kind of microscopic precision that we need. But hang on, what happens if the sample isn't soft tissue? What if it's something really hard, like a piece of bone? I mean, you can't exactly slice through a bone with a super delicate blade. So before you can even start the normal process, you have to do the complete opposite of hardening it. You have to soften it by getting rid of all the calcium. And this is a perfect example of one of the constant trade-offs in pathology. You could use a really fast-acting acid, like nitric acid, to get a quick answer, but you run the risk of damaging those tiny cellular details. Or you can use a much slower agent called EDTA. It takes way longer, but it perfectly preserves the tissue, which is exactly what you want for the most accurate diagnosis. It's always a balance between speed and precision. So, once the tissue is safely embedded in that wax block, we get to maybe the most delicate step of the whole process, sectioning. And this requires a truly remarkable piece of equipment called a microtome. It's basically a high-precision slicer that can cut impossibly thin ribbons from that tissue block. It's a real marvel of engineering. Just how thin are we talking about here? 3 to 5 micrometers. Now, to put that in perspective, a single human hair is about 70 micrometers thick. So we're talking way, way thinner. And it's that incredible thinness that allows light to actually pass through the tissue when it's under a microscope, making all the individual cells inside visible for diagnosis. It's amazing. Now, to get the full picture of Alex's health, one more crucial sample was collected: cerebrospinal fluid, or CSF. This is the fluid that bathes the brain and the spinal cord. And believe me, analyzing it requires a completely different set of tools and a whole different approach. CSF is collected in 3 sterile tubes, and the order they're filled in is absolutely critical. Why? Well, the first tube might have a tiny bit of contamination just from the collection procedure itself, so that one's used for biochemistry tests. The second one goes to microbiology to look for bugs. And that third tube, the cleanest of them all, is saved for the most sensitive test, the precise cell count. And you know what's wild? A lot of the time, the clues are visible right away. Normal CSF should be crystal clear, like water. If it's turbid or cloudy, that's a big red flag for a high white blood cell count, pointing to an infection like meningitis. If it has a yellowish tint, what's called xanthochromia, that could mean there was a previous bleed. These simple observations give doctors vital information, literally in real time. So, there we have it. We followed Alex's samples through the blood bank, through the histology lab, and through the CSF analyzer. We've seen the unbelievable precision and the immense care that goes into turning every single one of these samples into useful, meaningful data. And this really brings us back to the whole point of it all. You have these 2 incredibly complex, totally separate journeys, one for the blood, one for the tissue. And they all come together at a single point, providing a clear, accurate, and fast diagnosis that is going to guide Alex's treatment and their care. From a simple blood count to an impossibly thin slice of tissue, the pathology lab reveals the hidden stories that are being told inside our own bodies. And that just leaves us with one final, really exciting question. As our technology gets even more powerful, how much more detailed are these stories going to become? What new chapters in the book of human health are we just about to unlock?